vaginal surgery.
Can perform the surgery with laparoscopic procedure. It is different type of laparoscopy.
What was your path to your assistant professor?
Have separate rooms. For consultation room and examination room, to make it separate, it's much better and gives more comfort. This is examination room. Patient is laying here, and UZI is done, ultrasound is done. This ultrasound can be done. This is for abdomen to check if baby is okay, and this is
Vaginal
vaginal,
probe.
yes.
And also
Vaginal.
for the E3D probe for obstetric patients, and also we perform with this probe gynecological examinations. And with this table we perform abdominal examination and also gynecological examination and small operations.
A woman, after the conversation with doctor, comes to this room to get changed because if she needs vaginal, she needs to take her clothes at the bottom.
Yeah, I see this is why the new hospitals are important, because it allows the space for the new technology and the different facilitated things that are involved in today's medicine. You need a new hospital to build these things.
Doctor says that it's very important to have separate rooms. For consultation room and examination room, to make it separate, it's much better and gives more comfort.
These hospitals give space for the doctors to work, the nurses to work, the
And
patients to have a place to be.
Yes, and patients is not in rush to get.
They're built for
dressed.
everyone.
Yes.
Yeah, in the system.
This system is less stressful, also patient and doctor.
Let me tell you about Dr. Taha. Dr. Taha also has a big experience. He will use this experience in publications. He will use this to get the professor degree.
Last year, I was in Italy for the education about endometriosis and endometriosis surgery. And I performed this kind of laparoscopic minimally invasive surgeries.
Do you also follow up pregnancy, for example?
Yeah, of course. I follow up pregnancies and also risky pregnancies. I perform vaginal delivery, cesarean delivery, and also VBAC surgeries. Vaginal delivery after cesarean delivery.
Okay.
We can perform vaginal delivery, the previous cesarean surgeries.
Some hospitals have different kind of deliveries. Like one can be done in operation room. There can be also in patient room. Also, there can be in water. Do you have this kind of delivery?
Yeah, of course. We have epidural delivery, painless delivery, and also we perform water delivery in this hospital. This is popular also in Turkey. And the other issue is popular in Turkey, vaginal delivery after cesarean surgery. Most doctors don't perform this kind of surgeries, this kind of deliveries, because of the risks, because of the uterine rupture risks, delivery risk.
Can you tell us what was your path to your assistant professorship? What have you done until now?
My educations, do you ask me about?
Yeah, your education and work until you're assistant professor.
They are taking assistantship. It takes 4 years.
We did it.
Then they have state State responsible work. It takes 2 years. After the governmental hospital, our doctor started in university hospital.
Burada yapmamız gereken belli eğitimler var. Hem öğrenci eğitimlerine katılıyoruz, hem asistan eğitimlerine, hem de kendi çalışmalarımızı gerçekleştiriyoruz.
In this case, there is general education, then they have assistant education, and now there are some works that they are doing themselves. For example, they are writing articles upon some interesting cases.
So they're teaching and working at the university hospital for 4 years?
4 years it's assistantship.
Okay. This is the total time of teaching and working.
Onun belli bir süresi yok ama ben üniversitede 4 yıl geçirdim toplamda. Sonrasındaki eğitimde yani.
There is the first education is 6 years, and then for assistantship it takes 4 years.
Correct. After 2 years of working
After
for the
that-
state hospital.
Yes.
Yes.
After that, doctors can take some different educations, but it depends on their wishes. For example, some doctors wants to have like narrow specialization. In this case, they're just taking for 2 years educations.
After 2 years, I worked in Foundation University in Istanbul for 4 years as assistant professor. I perform surgeries and also perform articles and student educations. Gerekiyor.
During this period, doctors must give publications that will be published not only in Turkey but also internationally. Next to this, doctors also must write parts for book.
And this book is for the ministry, or this book is for the hospital?
It's education books.
Educational books.
Okay.
About gynecology.
Okay.
About
So that the educational books are modern. They're always
Yes.
changing to current
Yes.
current experience.
Yes.
Okay.
These publications are also presented not only at the universities but also on Congress, or there can be
International Congress.
academic academic presentations also.
Yeah.
These publications, they are giving they are past evaluation, and they are giving you grades, and you're collecting these grades. When you collect needed grades, then you can apply to associate prof and then prof.
Merit. This is it's a merit system, I believe. I think it's called a merit award. So a recognition for what you did is a necessary thing. It's a new thing. When you have your merit award system, I believe, is to where it needs to be. You can move forward.
But let me tell you one thing. There are a lot of doctors who can have a lot of experience, but they are not publishing it, and they're staying like they can stay like specialists, they can stay associate prof. If they publish, they will easily gain associate prof and prof. That's why when in Turkey we say associate prof or prof or specialist, just you need to check their experience. When they have really good experience, they have a lot of patients, and sometimes you just cannot book appointment.
Şu mesela bu dergi Japon Obstetri Gynecology Derneği'nin
It's
dergisi.
a Japanese journal for obstetrics and gynecology research.
Bu 2021-2022 yılında o dergide en çok atıf alan yayınımız olmuş bu
These
yazı
are
mesela.
top articles in 2021 and 2022.
Instagram sayfamda
So you
paylaşmıştım.
can see that
It says recognized as a top-cited paper.
Yes.
These publications, they must gain value in Turkish and international journals. I mean, those publications have significant interest to medicine, like world of the
Yeah.
My surgeries And mostly I perform endoscopic surgeries. The kind of endoscopic surgeries are laparoscopy and hysteroscopy.
These are minimal invasive
Yeah,
surgeries.
minimal invasive surgeries.
There will be only little holes, so when these performed, there will be no big scars. There won't be like
We
these
perform the surgery with these small incisions.
Yeah.
These are open operations, and this is small incisions.
This is an example of minimally
laparoscopy.
invasive.
Yes, yes.
Even the robotic surgery is done laparoscopically. It's like with
The robotic
a little-
surgeries and laparoscopic surgeries incisions are similar. We perform these surgeries with minimally invasive procedure. This is open surgery. This is laparoscopic surgery. This is after the first day of the surgery.
Okay.
And after first month, there is no incision, there is no scar, and hospital stay is decreased and less, and also the pain and the bleeding is less.
rehabilitation period is also shorter.
Less
when-
trauma to the body.
Yes.
Yes. I perform this surgery, diagnosis, and also treatment, and mostly infertility. This is leiomyoma, and the leiomyomas are the benign mass of the uterus. It may lead pain or abnormal bleeding or infertility. And
This is the most popular thing in woman body. I
Yeah.
mean, I guess every woman has
Yes.
it. It can be like early or in older ages.
approximately 60% of women have leiomyomas. Some of them lead some problems, and we should perform surgery. This is one of my surgery. We took approximately
Big
20 myomas from the uterus.
Okay.
We preserve the uterus and
Okay.
the fertility.
Okay.
And just take the myomas. This is ovarian mass. This patient is 11 years old, I guess. And there's 10 centimeter mass, dermoid cysts. We perform laparoscopic surgery, and we also preserve uterus and the ovaries in this process. And endometriosis, other most popular gynecologic problem. Some kind of endometriosis, we have to perform surgery. Some kind of endometriosis, we give medical therapy or infertility treatments. But in deep endometriosis and pain, we have to perform surgery. The laparoscopic surgery is the best treatment method for this problem. And also I perform hysterectomy for the patients with abnormal bleeding and leiomyomas and elder ages patients. We can perform hysterectomy. And another most popular problem is genital prolapsus. There's 3 kind of prolapsus: the uterine and bladder, and also bowels. We can perform these surgeries with laparoscopy, laparoscopic methods. And this is the image of the sacrocolpopexy procedure. Use this mesh. We take the prolapsed materials. Burada sarkan yapıları alıp kuyruk sokumu kemiğine asıyoruz mesh aracılığıyla. Bu ameliyatta temel olarak yaptığımız şey bu.
This mesh helps to gather what is loosey.
Yeah, uterine or vagina to the
To allow it
sacrum.
to heal,
Yeah,
right?
yeah, to the sacrum bone.
Yeah.
No, it like gathers.
Okay. Once it ruptures.
Yeah.
Yeah.
Not ruptures, but it's like losing. What
Is
after
this permanent?
Yes.
No, it's permanent, but some women when they give birth,
Yaşa bağlı olarak, doğumlara bağlı olarak veyahut da
Hmm.
kabızlık, kronik öksürüğe bağlı olarak.
there can be different reasons for having saggy or loosey inner organ. So it can be giving birth, it can be in older ages, and also it can be constipation problems.
Merhaba.
By this mesh, the looseness is gathered.
Striker 4K.
It makes
Teşekkür ederim. 30 derece.
uterus more tougher. Collects.
And the other problem is urinary incontinence. Sometimes types of urinary incontinence, we give medical therapy, but some type of urinary incontinence we have to perform surgeries.
So for laparoscopy, you need modern technology.
Yes,
It requires modern technology and facilities.
yes, of course. Cancers.
This is sentinel node biopsy. We can perform the surgery with laparoscopic procedure. And hysteroscopy is different type of laparoscopy. We investigate inside the uterus in this surgery with camera. This is camera system. We perform this surgery via vagina and investigate inside the uterus for polyps, myomas, and uterine malformations. We can perform this surgery and also adhesions. And this is another popular surgery type, vaginal natural orifice surgery. It means vaginal laparoscopy. In laparoscopic surgery, we perform the surgery via abdomen. From the umbilicus, we
You're going directly.
Yes, we put the camera via umbilicus in laparoscopic surgery. But we not surgery. Our camera and other systems is inside the vagina. We perform this surgery via vagina. We not. It's another popular surgery type in Turkey now. It's another most popular delivery type in Turkey. We have. This is our study about it. We measure the uterine wall thickness at 37 weeks of pregnancy. It gives us some information about the risk of uterine rupture. And also we give some treatments about HPV infection, vaccines, and also some treatments about it. That's all.